so much. Oh. Okay. So I am Leah Peters. I work for Susan G. Komen. We're a breast cancer organization based out of Salt Lake City. We cover the entire state of Utah for breast health services and education and outreach. I'm just going to go through a quick presentation about who we are as an organization, kind of what we do, and then I'm going to get into another section that is about breast self-awareness. And so we'll go ahead and get started. And then at the end, if we have time, come on in. Yeah. I have a little short video as well. So as I mentioned, who we are, what we do, and then the breast self-awareness. So the story of Susan G. Komen. Susan G. Komen, she's the one in the striped shirt on the left. She was diagnosed with breast cancer at the age of 33. And she passed 3 years later with metastatic disease at the age of 36. Our founder of the organization, Nancy Brinker, the taller one on the right, she made a promise to her sister that she would do everything she could to end this disease so that no one else has to suffer the way that she had. Her treatments were pretty intense and pretty devastating in the late 70s, early 80s. Our techniques were a lot more invasive and a lot more devastating. So in 1982, she started the organization, and the vision is a world without breast cancer. And our mission is to save lives by meeting the most critical needs in our communities and investing in breakthrough research to prevent and cure breast cancer. So we know that 1 in 8 women will get breast cancer at some point in her lifetime. The Utah affiliate started in 1997. We had our first Race for the Cure at the Capitol in Salt Lake. For 10 years, the organization ran as an all-volunteer organization. Our first staff was hired in 2007. We hired an affiliate manager to help things, and then we hired our first executive director in 2010. We've made a lot of changes in the last 6 years. In 2012, we actually became the Utah affiliate because prior to that, we'd only covered the 4 counties along the Wasatch Front. So Salt Lake, Utah, Weber, and Davis counties were all that we covered. We expanded to cover the entire state because we realized there's need outside of those larger metropolitan areas that are unique to the areas outside of the Wasatch Front. We have 5 employees at this time, and we have a very active and engaged board of directors and hundreds of volunteers. For our events in particular, so our Race for the Cure, I don't know if you've heard of the Race for the Cure, it's a 5K. It's we have upwards of 400 or 500 volunteers during the course of setup and the day before, the day after, things like that help us to do that event. So what we do, I mentioned the Komen Race for the Cure. We also have a gala, fundraising gala that is coming up in November. We do third-party events. Corey Barton was mentioned. He does the Shoot Like a Girl is what he calls it. He does a fundraising event for us, and everyone gets to dress in dresses and shoot targets, which is actually one of my favorite events because it's a fun event. Other cause-related marketing, individual gifts, and obviously corporate fundraising. We are primarily a fundraising organization, and I'll talk about where our money goes here in just a second. So 75% of what we raise actually stays in Utah to fund programs. So it may be screenings for women who don't have insurance, treatment support. We have an organization that provides rides. Do you guys know where Price is? So Carbon in Emery County does not have any radiation facilities. So if someone needs 6 weeks of radiation, it's every day for 6 weeks. I mean, you're in and out in a few minutes, but that drive from Carbon in Emery County is a nightmare over Highway 6, especially in the wintertime. So we actually fund a program that drives patients every day to Provo to get those treatments. So that they don't have to so family members don't have to drive them, take off work, that type of thing, because they're not usually convenient appointments either. It's during the day when most people are working. So that's another example of a program that we fund. And over $6 million has actually been invested since 1997 in Utah. and over 2 billion nationally. So we have over 100 affiliates across the entire United States, and we actually have 2 or 3 that are international as well. Some states obviously have more than one affiliate. We're the only one here, but you can see that part of that vision is investing in programs to help people today. And then we have sent over $2 million to our national organization for research, and collectively $920 million has been invested in research. We're really excited about that $2 million that we've sent to our headquarters has actually come back, more than that has come back to our Huntsman Cancer Research Facility in Salt Lake. There's a researcher there, her name is Alana Whelm, that we have gotten to know. She's a Komen-funded researcher. She has a couple of fellows working in her lab that are working on metastasis. So basically, breast cancer that has spread to other parts of the body, which is where it becomes dangerous. That's actually what kills people, is when it spreads. So she's working on those mechanisms to try to figure out how it spreads and how to stop it. So it's actually pretty exciting. So we serve our community. I talked a little bit about the active reentry that provides the transportation. 4th Street Clinic is a clinic that serves the homeless population in Salt Lake. So we actually fund on-site mobile mammography for them. They have a mobile unit that comes to the clinic where they're used to coming to get their medical treatments or medical services. And they will do on-site mammography services for those women. Cancer Wellness House is another organization that provides what we call complementary treatment programs. So counseling services, massage, yoga classes, acupuncture, things along those lines that kind of ease the symptoms of treatment or long-term side effects. They also have a counseling program for children of individuals who have gone through cancer.
Where is that Cancer Wellness House?
Cancer?
Is that Salt Lake?
It is in Salt Lake. It is right downtown. It is on 11th East and about 1st South.
So there's only one.
There's only one. Yes, unfortunately, these types of services are really hard, to get into multiple locations outside of a hospital facility. So Cancer Wellness House is actually pretty unique even in the country for the services that they provide. We do advocacy as well. So we've been involved at the federal level of advocating for additional research funding, as well as the breast and cervical cancer early detection program. And what that is it's a screening program for women who are uninsured. It will pay for their a breast and cervical cancer screening, as well as treatment if they're diagnosed. And then obviously outreach and education is what we're doing as well. And yes, if at any point in time you have a question, just interrupt me. I tend to get on a roll and talk. I will have time for questions after as well, but feel free to interrupt me. That's not a problem. So the research, I talked a little bit already about Huntsman Cancer Institute and what they're working on. But these are some of the other areas that we're investing pretty heavily in as far as research goes. I'm going to point out too the metastatic, which is again how it spreads, as well as triple negative, which is a really aggressive form of breast cancer. It shows up a lot in younger women as well as African American women. And there's no targeted therapies for that particular form. There's a whole variety. There's a whole range of types of breast cancer, which some people don't necessarily know. But so that triple negative means there's no hormone receptor. Most breast cancer is tied to estrogen, but the triple negative is not. So there are no hormone therapies that you can give to kind of help target that treatment. So usually the treatment has to be chemotherapy, it's surgery, it's radiation, it's like the whole shebang. Whereas with some of these others, you can do it with targeted therapies. You may not have to do radiation, you may not have to do chemotherapy, depending on the type and the stage that it's diagnosed. So some of the other, so we're actually looking at prevention as well. How do we prevent it? Because at this point, we're not really sure even what causes breast cancer. I'll get to that in just a second. But so again, environmental factors. There's a variety of things that we're investing in as far as research is concerned. So any questions on who we are kind of as an organization? If not, we can do after as well if you have any questions. So we're going to talk about breast self-awareness. So the statistics are over 230,000 women will be diagnosed this year with breast cancer. And about 40,000 will die. And that number has not changed significantly in the last 10 years or so. And there's a new initiative that Komen is focused on, which is we have a bold goal to reduce that number by 50% in the next 10 years. There's a reason why we feel that this can happen. Part of it is access. There's been research done that shows up to 30% of those deaths could be prevented if women had the proper access to treatment and early detection. So that is part of what we are working on, is making sure that people understand what resources are available and providing that access to treatment at an early stage.
So do you know how many, excuse me, men are diagnosed with breast cancer?
Oh my gosh, it's almost like you set me up.
I'm setting you up.
Right there. 1 in every 100 cases
okay.
are diagnosed in men. So for every 100 cases, 99 are women, 1 is a man.
Do they get the same services through Susan Komen as?
They would, yes. So we don't, the medical community does not recommend screening per se for men because it is so rare. But once diagnosed, they are treated just like any other patient. They are eligible for, any type of funding or programs that we fund, absolutely.
Okay.
Yeah. And it's, a lot of people actually don't even know that men can get breast cancer. So that comes as a surprise to some people. But yes, while not common, it does happen. And Utah ranks actually near the bottom in the nation for mammography screening rates. There's a lot of speculation on why that might be. But that's something that we're hoping to try to change, is to make people aware and understand that it's really not as bad as you think it is. I mean, it's not exactly, the most pleasant experience, but, a few seconds of discomfort can really make a huge difference as far as when you can actually diagnose. The most accurate mammography is a repeat screen. So if you go year after year, they can compare your screens from prior years to see if there's any changes that show up. That's the most likely to find it at the earliest stage, is a repeat mammogram. And roughly 13% of adult residents of Utah do not currently have health insurance. So that is one of the areas that we tend to target. We tend to fund programs specifically for what we consider underserved. So uninsured, underinsured, low income, maybe English as a second language, transportation barriers, rural communities, things along those lines that may not have as much access to the services. So what is breast cancer? Basically, it's just a disease where the cells divide and grow without the normal controls. So it's just, your body goes through and kills off cells and regrows new ones, and somehow something goes wrong and they start going crazy. So what causes breast cancer, I already kind of alluded to this, we really don't know. But what we do know is genetics play a part in it. Gene mutations is what causes breast cancer. They can be either spontaneous or they can be inherited. But most U.S. breast cancers are caused by spontaneous gene mutation. You may have heard of they're called BRCA1 and BRCA2. Those are inherited mutations that significantly increase a person's risk for breast cancer. But only about 5 to 10% are actually a known genetic link or known family history within those cases. So the vast majority are just a spontaneous response to either environment or to just part of it, So we do know that if found early, more lives can be saved. The breast cancer mortality rate has decreased by 33% since 1990. So part of that is we're catching it early, and treatments have improved, and you know, some of the more drastic treatments have been able to be scaled back because we realize that, you know, a radical mastectomy may not be necessary when a lumpectomy is just as effective. So, you know, oftentimes those would contribute to deaths as well. One of the things that we find interesting is that most women don't perceive themselves to be at risk because of this concept of, well, I don't have any family history, you know, I eat pretty well, you know, I don't smoke, so I don't think I'm at risk. Unfortunately, every female is a risk. That's the number one risk factor is being female. And there are currently over 3 million breast cancer survivors in the United States today. I'm going to talk a little bit about metastatic breast cancer. I talked a little earlier, but I kind of want to give a little bit more information on this because this, again, is what takes lives. So it's also called stage 4 or advanced breast cancer. So you may use, those terms are used pretty interchangeably. And it is just basically breast cancer that has spread to other parts of the body. So typically, bones, liver, lungs, and brains are the 4 areas that breast cancer typically spreads to. It is still considered breast cancer, even though if it shows up in your liver, it's still treated as breast cancer. So those targeted therapies, all of the chemotherapy drugs that are specific for breast cancer are still used. It doesn't become liver cancer, it's still breast cancer. Between 6 and 10% are initially staged at stage 4. So those are, again, initially, and it's typically, again, younger women who may not be getting screened, or you know, someone who has ignored a symptom for a time. It is treatable, but not curable. At that point, once it has spread outside the breast, you're not curing it at this point. We're hoping to get to a point where that's the case, but at this point, that it's not. But women can live. I mean, it's the survival rate once you are diagnosed at stage 4 varies drastically depending on your age, what type you have, where it is spread, things along those lines. I actually have a friend who is in her 13th year of metastatic, after her metastatic diagnosis, and she's still doing pretty well. So, and then recurrence, and this is one of the areas that that is kind of a new, and I don't want to say a new area, but an area that's getting more attention is between, and the numbers are hard because no one has really gathered this data, which is between 20 and 30%. They think even early stage breast cancer can come back, can have a recurrence even years later after the initial early stage diagnosis. One of the theories behind that is that it probably has already spread, even in those early, that early stage diagnosis is probably already spread, but it's lying dormant in those areas, just waiting for a trigger of some sort to continue to grow. And again, that's part of some of that research that's being done to figure out which cancers are more likely to have spread even at those initial early stages. And then we have 38 research grants this year from our headquarters that is specific to metastatic cancer. And that's another area that we're hoping to address those, that reducing the mortality rates by 50% is some of the new treatments and some of the new research that's coming out as well. Okay, we're going to go through breast self-awareness now. I'm going to go through each of these on separate slides, but these are kind of the 4 messages that we try to communicate to people. So number 1 is knowing your risk. So, I mentioned that the majority of breast cancers are a spontaneous mutation. However, family history does play a role. So knowing what your family history is and talking to them about it, maybe it was an aunt, that you didn't know very well, or an extended family member, but knowing that it runs in your family is valuable information to talk to your provider about. And then again, talking to your doctor about your personal risk of breast cancer. They can kind of help you decide what makes the most sense as far as your history and your personal risk is concerned. So some of the, you'll see at the bottom, there's a website, the Komen.org/risk. So there's actually a little tool that you can kind of go in and plug in some of this information, and it will kind of give you a risk assessment, to kind of help you say, well, do I feel like I'm at slightly higher risk or not? But the two most common, or I guess the highest risk factors are being female and getting older. So your risk increases as you age, and being female, you're at risk. And unfortunately, those are two things you really can't do much about. If anyone figures out how to fix that getting older thing, let me know. I'm sure there's some people who would like to invest in something like that. Other risk factors, obviously family history, I already talked about in depth. Other cancers as well. So prostate cancer in men is linked to increased breast cancer risk in female family members. Dense breast tissue, because there's more tissue for cancer cells to invade, as well as if you have dense breast tissue, it shows up white on a mammography screen, and so does a tumor. So it's often harder to see on a mammogram. The technology has improved dramatically with the new 3D mammography. I don't know if you've heard of this or not, but they're much more likely to see it on a 3D, especially on a repeat 3D mammogram. But it still can be made. Mammography is not perfect. It still can be missed. When I get to the next one, we'll talk a little bit about that as well. And then, again, known risk factors that you can control, others you can't. So getting screened. So this one is a little controversial. I'm sure most everybody has heard about some changing guidelines, that it used to be 40, now it's 50, maybe it's 45. We don't as an organization make specific recommendations, but what we advocate for is that anyone who has a concern, anyone should have access to screening regardless of age, regardless of anything. You should be able to have access to those tests. If a doctor has recommended it, should be available to you. One of the things, so we say starting at age 40 if you're at average risk, but if you have a concern or an issue, it should be available for you to get it screened and get it checked out regardless. Then there's also having a clinical breast exam at least every 3 years starting at 20 and every year at 40. So clinical breast exam, so a physician that has been trained and knows what to feel for is more likely to find it during a clinical breast exam, even than myself doing a self breast exam. So we do recommend that as well. So this is probably one of the most important parts of it, though, is knowing what your normal is, because everybody's breasts are different. Each side is different. Your left side might feel different, look different than your right side. But knowing what they look and feel like and being able to communicate that to a healthcare provider if there is a change. So we'll talk about some of the changes. So we're really good about talking about lumps, right? Everyone's like, oh yes, if you feel a lump, if you feel a lump. Well, there's some other symptoms that could be signs of breast cancer. They may not be anything serious at all, but these are all changes that should be addressed. So a swelling or redness or darkening, a dimpling in or puckering of the skin, a change in the size or the shape, an itchy, scaly, sore or rash on the nipple, a pulling in of the nipple, any kind of discharge, or any pain in one spot that does not go away. Now some people will say, well, cancer doesn't hurt. Usually it's a lump, but cancer doesn't hurt. It can. So pain can be a sign. Could be nothing, could be something serious. So something to get checked out. And then the fourth part of it is, just maintaining healthy lifestyle choices. So maintaining a healthy weight, adding exercise, limiting alcohol, limiting the use of postmenopausal hormones. That's hard for me to say, postmenopausal hormones, sorry. And then breastfeed if you can. So those are all known things that you can do to reduce your risk. It's not going to prevent breast cancer. None of this prevents it. It just reduces your risk. So just to review, know your risk, getting screened, knowing what your normal is, and then making healthy lifestyle choices. And again, just to reiterate, every woman is at risk. Mammography can detect tumors at an early stage when they are small and most responsive to treatment, and years before they can be felt. So mammography can pick up even the tiniest of changes that you would not feel for a very long time, especially those if they're up next to the chest wall. Those are usually the hardest ones to detect by being felt. Again, our screening rates are some of the lowest in the nation. And make sure you share something that you learn with someone that you care about. So, any questions? That was a lot of information. I know I talked really fast. I apologize. So. No? Okay, well I can stay after if you wanted to have any questions. I'm going to try and get this video to play. How do I get it to show up there?
The camera view,
I know.
he knows everything.
Anyways, you can see. Oh, look at that. Okay.
Is her sister still alive? and
Yes.
Still part of the organization? right?
She has, she's actually retired from, she's just a volunteer at this point, but she actually is a survivor as well. She was diagnosed with breast cancer as well.
Give it all you got, no hesitating. You've been waiting all your life. This is your moment. This is your moment. Time. This is your moment. This is your moment. It's closer than it's ever been, and now it's more than just a win. It's where your life begins.
So obviously the message of that video is, we're more than just color, we're more than just paint, we're more than just pink ribbons. We actually do a tremendous amount of work in the communities that we live and work in. So anyway, thank you so much for your attention. Like I said, I can stay for a few minutes if someone wants to ask, questions that they don't want to ask in front of everyone else or whatever. So thank you so much.
Thank you.
What's that?
How did you get involved with it?
How did I get involved? I was volunteering with a different organization actually, and a friend of mine was volunteering and asked if I wanted to get involved. I had done the race several times, for several years in a row, and I would go and I would do the walk, and because I walk, I don't run. But I would go and then I would just go home. I didn't really understand what the organization did. I thought it all went to research and it went to some, organization somewhere else. I didn't realize that they did things locally. And once I understood, this friend of mine told me, you know, that the money gets invested locally, I went, oh, people need to know this. So that's how I got involved. I actually run the grants program, the community grants program, which is the best job, I would say, but also one of the hardest jobs because sometimes we have to tell people no, that we don't have enough money to support their programs and things. But so that's how I got involved. I do not have a close family member that has been impacted, but it's amazing. I feel like the women that I know that have been diagnosed, they feel like part of my family now. Thank you for asking. I appreciate that.
Do you do funding for, let's say that you wanted to have the genetic testing and
So-
insurance didn't cover, would some of this funding help with that, or?
So none of our current, so the way it works is, so we have the funding and the people apply to us with specific programs to address some of those needs. I have not been asked to fund a program specific to genetic testing at this point. I do know that Myriad, who kind of created the test initially, has a program that will provide free genetic testing with certain qualifications. I'm not sure what that program is. And there's also a national organization, and I can't off the top of my head remember what it's called, that does support genetic testing, in particular for younger women, because those, you know, so if you know that your mother and grandmother have been diagnosed, there is a likely chance that there might be a gene. I think they focus a lot on doing the genetic testing for younger women so that they kind of can plan in advance, because there are obviously preventative measures that you can take to reduce your risk. So it's kind of a long roundabout answer to that. There are resources available, and if you wanted me to look into it, I'd be happy to, give you my contact information, and I can do a little bit of digging on it to see what organizations do support that. Be happy to do that. Anything else? Awesome, thank you so much.
Okay, let's give her one more hand.
Thank you.